You've worked hard your whole life, and now, when you finally deserve some peace of mind, it can feel like the cost of your prescription drugs is still holding you hostage. You open the pharmacy bill and your heart skips a beat. Another few $100s this month. Again. You wonder how long you can keep paying these prices, even with Medicare. But what if I told you that, starting very soon, there's a major change coming that could completely transform the way you pay for your medications? A change that limits how much you'll ever have to spend out of pocket each year, no matter what prescriptions you take. This is not just another policy update. This is one of the most important cost-saving reforms in Medicare history. And if you're a senior on Medicare, this $2,000 cap on out-of-pocket drug costs could be the most impactful change you'll see in your lifetime. Let's talk about what's changing, how it affects you, and what steps you can take right now to make sure you're getting every dollar of savings you deserve. Now, I know what you might be thinking. I've heard promises before. They always say prices are coming down, but my bills keep going up. You're right to be skeptical. For years, drug prices have risen faster than inflation, while seniors like you have been left with tough choices. Cutting pills in half, skipping refills, or going without medicine you truly need. But this time, things are different. Here's why. The new law, part of the Inflation Reduction Act, sets a firm legal limit on what Medicare beneficiaries will pay for prescription drugs by 2025. No one with Medicare Part D will pay more than $2,000 per year out of pocket for covered prescription medications. That's a game changer. Think about it. If you currently spend $500 a month on prescriptions, that's $6,000 a year. Starting next year, your total cost could drop to a third of that. No matter how many medications you take for millions of Americans on fixed incomes, this is relief you can actually feel. But let's break down what this really means, because there's a lot of confusion out there. Right now, Medicare Part D has a complex cost structure. You start with a deductible, then pay a percentage during what's called the initial coverage phase. After that, you hit the coverage gap, what many people know as the donut hole. Eventually, you reach what's called catastrophic coverage, where your costs drop but never completely go away. Even after reaching that level, you still pay 5% of the drug cost for the rest of the year. If you take expensive drugs, that 5% can still mean hundreds or even thousands of dollars. And that's where many seniors struggle the most. But under the new $2,000 cap, that 5% cost disappears. Once you've paid a total of $2,000 out of pocket for your prescriptions in a calendar year, you're done. The rest of your covered drug costs will be fully paid by Medicare and insurance plans. No more donut hole. No more endless copays. No more wondering how much the next refill will drain from your Social Security check. This is a historic step toward making healthcare more predictable and affordable for older Americans. Now let's imagine a few real-life examples. Meet Margaret. She's 72, living in Ohio, retired after a long career in teaching. She takes medications for diabetes, high blood pressure, and arthritis. Each month, her prescriptions cost her around $400 after insurance. By the end of the year, she spent nearly $5,000 out of pocket. That's nearly half her Social Security income gone to medication alone. Under the new system, Margaret's annual spending would be capped at $2,000. That means over $3,000 in savings each year. Money she can use for groceries, bills, or simply to breathe a little easier. Now meet Richard. He's 68, just enrolled in Medicare last year. He was diagnosed with a rare autoimmune condition that requires a specialty drug costing over $10,000 a month. Even with Medicare coverage, he's been paying thousands every year in copays. When the new cap takes effect, Richard will finally have financial protection. After he hits the $2,000 limit, every refill for the rest of the year will cost him nothing more. That's peace of mind that money can't buy. But let's not sugarcoat it. There are still things you need to know. Not every drug plan will automatically adjust the same way. Some plans may handle payments differently. Some may change premiums or coverage options. So it's more important than ever to review your Medicare Part D plan during open enrollment. Make sure your plan is ready for the 2025 changes and that it covers all your prescriptions under the new rules. If you haven't checked your plan yet, now is the perfect time. Medicare's open enrollment period runs from October 15th to December 7th each year. You can compare plans, see projected costs, and make changes that could save you hundreds or even thousands of dollars. And remember, this $2,000 cap applies to out-of-pocket costs under Medicare Part D, the part that covers prescription drugs you pick up from the pharmacy. It doesn't apply to medications you receive during a hospital stay or in a doctor's office, which are typically covered under Part A or Part B. But here's something else you might not know. Even before the $2,000 cap fully kicks in, Medicare is already phasing in other cost-cutting measures. In 2024, the dreaded 5% coinsurance for catastrophic coverage disappears. That's the first major step toward the full cap in 2025. And by 2026, Medicare will begin directly negotiating the prices of some of the most expensive brand-name drugs on the market, something that was never allowed before. This negotiation power is expected to drive down prices not just for Medicare beneficiaries, but across the entire healthcare system. Over time, that could mean lower drug prices for everyone. So what should you do now? First, review your prescriptions. Make a list of every medication you take regularly, including the dosage and cost. Then check your current Part D plan to see what your out-of-pocket expenses look like for the year. Second, if your total drug costs are already high, say more than $2,000 a year, prepare for how much relief you'll see next year. Understanding your savings can help you budget better and make informed choices during open enrollment. Third, stay informed. Many seniors don't realize that small changes in Medicare law can have big impacts on their wallets. That's why channels like Medicare Mentor exist, to break down these complex changes into plain language you can actually use. And speaking of that, if you're finding this explanation helpful, make sure to hit the subscribe button and turn on notifications. That way you'll never miss a video that could save you money, protect your benefits, or help you get the healthcare you deserve. Now let's go a bit deeper into what this cap means for the future. For decades, Medicare's prescription coverage worked on a model where patients and insurers shared costs. It made sense when drug prices were lower, but as new, more advanced treatments came on the market, costs skyrocketed. A single pill for a rare condition could cost thousands of dollars, and seniors, even with insurance, were left to cover a percentage of that. This system punished the very people Medicare was created to protect. With this reform, Congress and Medicare are acknowledging that it's not fair for retirees to face unlimited drug expenses simply because they get sick. The $2,000 cap creates a safety net, an upper limit that says this far and no further. It's a recognition that good healthcare shouldn't mean financial hardship. Some experts estimate that nearly 19 million Medicare beneficiaries will benefit directly from this change in the first year alone. That's a massive shift in affordability and stability for older Americans. And it's not just about money. When people can actually afford their medications, they're more likely to take them as prescribed. That means better health outcomes, fewer hospital visits, and a better quality of life overall. Imagine being able to refill every prescription on time without worrying about whether you'll have enough left over for groceries. That's what this change is about, restoring peace of mind. Of course, with every major change, there are always questions. Some people ask, will my premiums go up because of this? The answer is possibly, but not drastically. Experts predict a slight adjustment in premiums over time, but the trade-off is significant. Predictable costs and no surprises. And for those who rely on high-cost specialty medications, the cap is a clear win. The savings will far outweigh any small premium increase. Others wonder if this will affect drug availability. The short answer is no. Medicare beneficiaries will still have access to the same medications they do. Now, what changes is how much you personally have to pay. So, as we move closer to 2025, here's what I recommend you do. Stay alert to updates from Medicare use official sources or trusted channels like this one to keep track of when the changes go into effect. Talk with your pharmacist or insurance agent. They can help explain how your plan will handle the transition. And most importantly, don't let confusion or frustration keep you from getting the coverage you deserve. These changes are designed for you to make your retirement years a little more comfortable, your healthcare a little more affordable, and your peace of mind a little stronger. At Medicare Mentor, our mission is simple: to help you make sense of Medicare so you can save money, avoid mistakes, and get the care you need without unnecessary stress. So if you've ever felt overwhelmed trying to navigate Medicare, you're not alone. Stick around. Together, we'll go step by step through every major change, like this $2,000 cap, and show you how to make the most of your benefits. Because at the end of the day, Medicare shouldn't be a mystery. It should be a promise. A promise that your health and your financial well-being are protected, no matter what comes next. So, take a deep breath. Relief is finally on the way. The $2,000 out-of-pocket cap isn't just another number. It's a symbol of a fairer system, one that finally puts patients before profits. And for millions of seniors across America, that means hope, security, and a future where you don't have to choose between your medicine and your groceries. If you found this breakdown helpful, don't forget to subscribe to Medicare Mentor and share this video with someone who might benefit from it. Because every senior deserves to understand how these changes can improve their lives. And every dollar saved can make a difference. I'm Dr. James from Medicare Mentor. And remember, when it comes to your health, knowledge isn't just power, it's protection.